Now, without any further ado, let me introduce everyone to our dear Medical Director, Dr. Joseph Fanoff.
Thank you very much, Jimmy. Thank you everyone for coming. I'm very happy to be with all of you. And can everyone hear me okay in the back? Okay, good. So, the purpose of this meeting today is to celebrate all of the good work that all of you have done over the past 20 years to keep the Ashland Medical Clinic, first of all, to start it, keep it going, and everything that's gone on over the past 20 years. So I'd like to thank each and every one of you for doing this. There's basically, when I counted up all the people that have helped over the last 20 years, it's approximately 1,000. That's a lot of people. We expect, yes, that's amazing. And so we expect about 180 today here. So I want to thank everyone. And what I'm going to do now is tell a little bit about who and what inspired the Ashland Free Medical Clinic. And then a little bit about its early history and everything that happened from the start and how it grew and offered more services. And to try and celebrate the inspiring stories of so many volunteers that have helped over the past 20 years. So, the story of the Ashland Medical Clinic actually began in 1986 when I was 35 years old. I heard about a person in India by the name of Satya Sai Baba. And I heard that he did a lot of amazing things. And the things that piqued my interest was that he helped people become a better version of themselves, a better human being. And also to use their knowledge and their skills to help those in society, especially those that were in need. So for example, for a doctor, he said there's many people who cannot afford medical service. And so you should provide that to them free of charge. And he said every doctor should work at least 1 day per week, seeing patients for free. So I took that to heart when we started the clinic, and 1 day a week, we were seeing patients at the Ashland Free Medical Clinic. And also at that time when I met him in 1986, I was fortunate to be able to speak with him on the very first, the second day that I was there. And he came up to me and spoke with me. And I was very happy that he welcomed me like that. And then he allowed me to start working in his hospital, which is the picture that you see right now in 1986. I might have been one of the first Westerners to be allowed to work in the hospital, I'm not sure, but certainly I was the only Westerner when I worked there for the first 4 or 5 years. And it was a great honor to work there. And this is a crew on the very first day. And Bob Swanson is here. Bob Swanson was thoughtful enough to come, and he also took a nice movie and all the photographs on the first day from Supervisor Miley's office. He's been there from the start. I have a lot of good stories to tell about Bob. Okay, this is at the 10-year mark. I'll leave it on for a few seconds so you see if you see anyone, you might see yourself. This is at the 15-year mark. And, oh, I'm sorry, we're already up to 20. So this is 20 years, 15 years, 10 years, and the very start. I think one advance when I wasn't paying attention. Okay. So we opened in 108-2005, mainly a primary care clinic. We also offer dermatology services since I was working there. And over the years, 25,200 patient visits over the last 20 years. Thank you. From all the hard work of all of you out sitting in the audience, so thank you. What I noticed in India is that when someone does good work with good intentions, like what Sai Baba did, all the resources come down. The universe will conspire to, support you. God will make sure that it happens. So I thought there's 3 things we need. We need a building in a good location. We need some money, because I know it's going to cost some. Even though no one gets paid at our clinic, we still have to pay for malpractice insurance. We pay for the labs for our patients. There's plenty of expenses. And then we need human resources, the most important, and you've got an idea of the wonderful human resources we already have. Actually, 1,000 human resources over the past 20 years. And so let's start out with the first one, building a good location. I did a survey on the internet, and according to the Public Health Department, the poorest neighborhood with the most social needs in Alameda County at that time was the Ashland area in San Lorenzo. I knew Bob Swanson at that time. He says, Joe, the San Lorenzo High School happens to be located right there. On one side of the property is Ashland, the other side is Cherryland. Perfect spot, and they already have a school-based health clinic. I said, fantastic. So he suggested I talk to the school, which I did, and we got permission with a memorandum of understanding to use the school clinic on Saturdays and also on Wednesday evenings when we started pediatrics, free of charge. No rent, no utilities. We just have to pay for insurance, for the building, which is not too expensive. So that happened very fast. And then the second thing I thought, where are we going to get the money? So when I went to the first meeting with the high school to discuss a memorandum of understanding, it just dawned on me that we didn't have a single penny in the coffer, and we need a lot of money. So what I did is, I got down on my knees in front of my altar, and I prayed to God. I said, Dear God, please help us get money in some way. We're going to need a good amount to start this clinic. And then I went to the meeting that thought, and I didn't think about finances anymore. And so in the middle of the meeting, we're talking about the MOU. Bob Swanson comes in. The meeting had already started. Somebody was talking. And Bob was sitting there, and then he's like sitting, and he's getting like, he wants to say something. He got up and interrupted. He says, I can't keep it in any longer. I have to tell you something. He says, Joe, I just spoke with the accountant today at Miley's office, and he said that we just noticed an additional $100,000 appeared in our bank account. We don't know where it came from. It just appeared. He said, we thought of your clinic right away. We'd like to give you $10,000 of that $100,000. He said, I know $10,000 is not much to do a medical clinic, but it's seed money to help get you started, and other people will take you seriously if they know that Supervisor Miley, who's in charge of this whole area, takes you seriously. Bob, I don't know how you knew that, but all of that came true because just about a month or two later, so we got $10,000 right away from Supervisor Miley's office. Then at Kaiser, I got an email saying, if you do some community project to help the community, you can apply for the David M. Lawrence Award, and if you're the winner, you'll get $10,000. So I applied. So I made it to the regional final. I made it to the national round. And then they announced the winner. And it wasn't us. It was another clinic from Southern California. If I would have been voting on the board, I would have voted for them also because they have been doing a clinic in Southern California just like ours for several years, and we were getting ready to start, but we hadn't seen a single patient. So anyways, the people in charge of it was the first year, and they said, we just intended to have one winner, but two of the runner-ups are so outstanding, we'd like to give them a little something. So guess how much they gave the Ashland Free Medical Clinic? Any guesses? What's that? 5,000? 50,000, I heard? Okay. Or maybe 15, okay. They gave us 20,000. Have you ever heard before of anybody getting born in second place twice as much as the first place? Oh. That's not a miracle. I don't know what it is. So anyway, and then shortly after that, we started seeing patients. We burned through the first 10,000. We burned through that 20,000. We needed more money. So I talked to someone at Kaiser at the main office, who are the people who wrote the checks. I said, we run out of money. Is there some other grant or something I can apply for? And they says, no, nothing like that. But I tell you what, we'll just give you an extra 10,000. I don't think Kaiser's ever done that. So we got an extra, so we got 30,000. And then, because I had not officially won the award, somebody else nominated for me for that, a pulmonologist by the name of Dr. Sai Harinath. And so that year I actually won it. So we got another 10,000. So 40,000, where every other winner had just got 10,000. So miraculous things have happened like that, and many more. I could actually tell many people, by the way, and I'm sure many in the audience have given donations of various amounts, and we are very grateful for that. And so, it's been a blessing. And I will mention that all the money that we receive, since nobody gets paid, there's not anyone in the organization that gets paid anything. The good part is that any money that's donated to us or that we get from a grant, all goes to patient care. Okay. In gratitude for the first people who gave us some money to help us run the clinic, I'd like to present this to Supervisor Nate Miley's office, and Bob Swanson will come up on behalf of them to receive the award. Thank you, Bob. Thank you. Okay, so let's give a hand to all the volunteers there. And that concludes what I'd like to share with everyone, and I want to thank everyone from the bottom of my heart for coming today to be with us. So happy to see all of you. So grateful to all of you for helping the Ashland Free Medical Clinic be a success. And so you're welcome to mingle it a lot of times. I mean, I know that you've seen a lot of people you haven't seen for years, and we can, there'll probably be more pictures taken. You can have a good time. We have some refreshments outside, so they're out this side. So we have some food items, some snacks, and some drinks. And we also have 3 presents for everyone we'd like to give everyone as a token of appreciation. And one of them is a real nice mug with Ashland Free Medical Clinic on it, and a couple other things, a brochure, and a little pendant or a pin to put on that some people may like. So we thank you for coming. And if anyone wanted to say anything, the program is concluded now. However, if anyone wanted to come and say a few words up front, we have a mic here. You're welcome to come up and say a few words. And thank you again for everything. God bless you.